All right, everybody. I'm Liza Vilnits, founder and CEO of Beyond Trending. Welcome to our new series, Beyond the Headline. This is where we dig deep into a specific article with a subject matter expert to talk about the piece and really get their perspective. Did they cover everything? Is there maybe another perspective that wasn't unpacked? What else can we talk about to really digest a piece with the person who's on the ground, has that great perspective? So today, I'm really excited to have Thiv Paramsothy on. He is the CEO and co-founder of Hera Fertility, and that's where he helps men become fathers, as well as improve how patients access and pay for fertility care. So a bit more about Thiv. He's a founding member of Parenthood Ventures, which is a founder ecosystem for parent tech. He is an advocate for healthcare reform and has spent his career working in health tech, startups, hospitals, and primary care clinics. And he's also impressively had a successful exit where he sold his telehealth company, AdraCare, to Well Health Technologies in 2021. So that's quite a bio, Thiv. Thanks for coming on with us. Tell the folks more about what they need to know, either about you or Hera Fertility, that maybe I didn't cover in that quick bio.
No, that was a great bio and brought back memories. Even 2021, I didn't realize how far long ago it was. But a few other things is, I was born and raised in Toronto, so made the move really for Hera and to make it so that we can have Hera available internationally. And then last thing is just truly I have a passion around healthcare and now right now fertility just because it affects so many people. But yeah, I'm excited to be here and thanks for the opportunity.
So, the article that we're going to be talking about today was a piece that ran in Fortune Well. It was written by Beth Greenfield, and the title was Four Possible Modern Day Factors Behind Infertility. So, the first paragraph cites a statistic, and it says that in the US, approximately 12.7% of reproductive age women seek infertility treatment each year. It does note that that statistic excludes men with infertility issues. So that's obviously your area of expertise. So I'm curious your take, what do we know about male infertility rates?
Yeah, so right now, what we're learning about male infertility is about 50% of the infertility cases are due to some sort of male factor contributing to it. And then when you dig deeper, about 20% of these cases are truly solely only about due to the guy.
Mm,
And so you could see from there that men play a big role in these infertility cases. But the way Beth has put it, and it's frankly correct, is because of the way that we collect the data on infertility rates and how many people are seeking for treatment, um, they are getting it from the women, and there's a whole discussion around that, but really it's because of the diagnosis and the definition where how long have they been trying and have they been successful
mhm,
that they're having to only survey and collect data on the women.
mhm.
Um, and this I understand the data, why they're doing it, and this just is a general thing. I feel like my take is in healthcare, sometimes that's the best way to do it. But when you couple it with the other data around uh, who's actually causing this, because it takes two to tango here, you can understand that men play a big role in that rate going up now.
Yeah, definitely. Yeah, and the piece does do a good job also noting, and there's an expert that they interview all throughout, and there are of course a lot of disclaimers of like, well, this is what we think, and certain areas are not 100%. And of course, the way data is collected, we need to kind of like take it with a grain of salt.
Mhm.
And I know in that kind of intro piece where they talk about the definition of infertility, and there was a piece in there too about they're looking at women who are married and who, haven't had success getting pregnant if they're not on, birth control for a year. And so it also notes like not every woman that's trying to get pregnant is necessarily married. So like that's a whole nother piece of it. So,
Yeah.
of course the numbers, you can always look at it in certain ways, but
And it's a really good point. And my background's in this space of public health and stats, and frankly, there's never a perfect stat out there.
yeah.
And so I love that we're talking about this and highlighting that there's these things, especially the marriage one. They should really change that. But it still is a good measure to because frankly, we're seeing that right now and the rising rates of people seeking infertility treatment.
Yeah, definitely. So I like that the piece was like really digestible. It had the 4 points. So let's talk about them one by one. So the first one that it says, one of the factors behind infertility is maternal ages rising. And it does say that that's like the number one most established definite factor. So what are your thoughts on that?
Yeah, it's and I want to make sure I don't think it read that way where it's like on the women, but it truly age does play a big role. You look at a bunch of studies, and frankly, that is one of the major reasons why people are seeking infertility treatment. And maybe one thing I want to make sure is clear, just in general, is that I like to call it assistive reproductive treatments because it's assisting you here. So it's like in the past, you would be able to naturally conceive, especially if you're younger, as she's pointing out. But now you're needing assistance to as you get older. So I think it is one of the number one reasons why, if you talk to doctors and you look at the data,
Mhm.
and we are seeing that. If you look at the data, let's use New York, back in I think it was in the 70s, it might have been the 80s, where the age of mother where they had their first kid is like
Mhm.
22.
Mhm.
And then now it's, I think last time I checked, 29.
Mhm.
This big jump that's gone up, and what's resulted is a drop in fertility or the increased need of these assisted reproductive technologies.
Yeah, makes sense. All right, so the jury's out on that one. What about number two, which they talk about obesity being a factor?
Yes. So obesity is, and I do think it's one of the major reasons, as we probably know, we get bombarded by it, is especially with the Ozempic stuff, is that obesity is very high in this country, and it does play a role in both the women and on the men's side on your fertility rate. So I do agree with them pointing that out, and it affecting both
Mm-hmm.
is key. We see that on the men's side a lot, where it's essentially a disrupting the hormones. It's a becoming very much a metabolic issue now,
Hmm.
and we're actually seeing surprisingly, and we just published a webinar on this, and I was surprised by this, but the especially with Ozempic, a lot of people are having kids because of they losing weight. They call them Ozempic babies, which is a whole nother thing. But yeah, VC does play a major role. We constantly advocate for both partners to um, definitely look at their lifestyle and where they're at on their weight and see if they can improve it. And it does, when you retest them, it does show improvements.
Yeah, makes sense. Keeping your body
Yeah,
healthy as possible. Yeah.
exactly.
So number three, I thought was an interesting one. Obviously, I'm not an expert in the space, so that one I was like, oh, I never thought about that.
Mm.
They talk about the legalization of marijuana and that having an impact on just more usage of marijuana and decreasing sperm count. So I
Mhm.
don't know, is that something that you've read about, or is that something that you've seen directly?
Yeah, I have. I've done a lot of research in this space because I was like you surprised. And I think here they highlighted that there's been two studies kind of, and there's been some contradictions, so people are unsure about it. I think more and more, if you look at what I've heard from clinicians, what I've seen at conferences where they're presenting new research, is that it's becoming clear that cannabis does have an impact on both patients. And especially on the guys, I would say.
Mm-hmm.
So just in general, especially if you're trying to have kids, what we recommend on the guys is definitely like remove what I like to call the vices. So marijuana, alcohol, all of these things that can play a role on this fertility journey. It's best to remove them out while you're trying to have kids.
Mhm.
But yeah, I would say like we recommend that to every patient. And in general, it's showing more and more evidence around it impacting.
Yeah.
But I get the way I read it from the author, and I'm curious to get their take one day, is it's not conclusive, so it's good to highlight both perspectives. And
Yeah.
honestly, you see that a lot with fertility in this space, just because it's a new industry and it's a
Mhm.
growing problem. So I think over the next 5, 10 years, we'll get more data and definitive
Yeah.
clarity.
That's all you can hope for, right? Is just like the more people are talking about it, the more research and investment there will be in this space so that those ideas and hypotheses like become more solidified over time, right?
Exactly.
Yeah. All right, and then the last one they talk about is just different environmental toxins. And again, that one was kind of approached similarly in the sense of like not a lot of concrete data, some hypotheses here, et
Yeah.
cetera, and with, kind of different types of toxins. But what are your thoughts on that one?
Yeah, it's interesting because this one I used to be no, that can't be it. And now seeing more and more of the data coming out, um, I truly think this is something that we'll see in the next 5 years, getting more clarity that it plays a big role,
Yeah.
especially the plastics. I I think I want to like what I've heard anecdotally is people focusing on that and then it's helped them on their journey. But I would love to see more research showing clear, like definitive answers here
Mm,
of that role. And I think that's why it's also ranked fourth. But if you look at some of these other researchers out there, like Shauna Swan, who have now, been doing more and more research to show, especially on the sperm side, that
mm,
that this is probably playing the biggest role in the decline in sperm.
interesting. Yeah, it's scary to think about because I think it's something that folks probably don't think about in their day to
Yeah.
day. It's just the world that we live in. But then when you put it under a magnifying glass and then maybe start to analyze, like, am I ingesting, these types of chemicals, whether it's through the air or the products that I use, and then you're like, wait, is there a correlation? And I can see how people go down a rabbit hole, and maybe it's a little
Yeah,
bit scary one. So, but obviously we need to be having these conversations openly. So,
exactly. And I think it's hard because it's also an environmental toxin. And I think if you look at all the studies out there, it's been difficult to create a study that conclusively shows that. Um,
mhm,
and but I think there's been some really good, interesting study designs and studies recently published that studies that have been published with interesting study designs
mhm,
that have kind of moved it up so that it's getting clear that this does play a role.
mhm,
And frankly, we recommend it just because with fertility and when you're trying, like it's best to just be thinking of all the different scenarios to like eliminate if
mhm,
possible. And then especially with the guys, if you do that, you can actually see an improvement in 3 months, 3 to 6 months. So like, and it's just such a short time for them to do that. So, uh,
mhm.
yeah, we do recommend those pieces, but I hope in the next 5 years there's going to be some clear studies that correlate, show strong correlation here.
Yeah, I'm sure it's something that everyone will be keeping an eye on. So those were kind of the four factors that they talk about in the piece. I'm curious, is there anything else that they didn't touch on that you're like, oh, you can't talk about infertility without talking about this one other factor?
Yeah, I think so. To pin it down to just four, it's a difficult one, but I get it. It's a piece there. Uh, we, this is why we like to cover over, like, take in everything about the person, what
Hmm.
their lifestyle is like because I think there's a bunch of other factors that are at play too. Stress has been a big one that's showing its impact on, and especially with men, you can conclude like you could look at the sperm and be like, oh, look, your results have changed. So stress is shown. There's been studies showing that that's had an impact. Sleep
Mm-hmm.
as well. So I would say those are big ones. I think nutrition, I'm surprised that that wasn't highlighted or coupled in one of those.
Mm,
maybe with the obesity, but just general nutrition.
yeah.
It doesn't mean that, you could be not obese, but you're eating not the right foods.
Yeah. Great
Especially
point.
ultra processed foods have been shown to have an impact on fertility.
Mm,
So I would really want to highlight that one because it's so important. You want to be eating the right foods during this journey.
yeah.
Um, and then we can always go down a rabbit hole of different things there. I think with the toxins, it was very much what I was thinking was like endocrine disrupting chemicals.
Mhm.
Um, and then lastly, I think just male, I'm biased, but I truly think the men's declining men's fertility should be on its own, just
Mm,
to highlight it, and we could talk more about it, but because it plays such a big role, but
yeah.
it's not a focus in the journey with patients. We've talked to hundreds of patients, and it's always an afterthought. Uh,
Yeah.
so would love to bring that up.
Yeah, that's a great point, and I think kind of a perfect segue for us because I do think so. Just personally, like when I think about infertility, I do think most of the conversations are focused around women. But when I read this piece, I was pleasantly surprised that there were several times where they are talking about like sperm count and the male's role. So I thought that it did kind of bring it into the piece and keep it top of mind for the reader. So I guess just societally, from your perspective, do you feel like, conversations have started to shift, or is it, kind of how far along are we in the journey? And I guess what do we need to be doing, I guess, to make sure that men's role in this journey is also highlighted?
Yeah, it's a great question, and it's my mission to tackle. I think societally right now we have made improvements, but it's still such an issue where, I think our bias just immediately goes to the women. Sometimes I even catch myself uh,
Mm,
if someone comes to us with a fertility issue. Um, but I think that it's changing, but we still have a lot of work to do on the
mm,
awareness level, on the system level of changing how the health system is set up right now for fertility, because it's so much of an emphasis on the women, and it's built around that. And I understand why, right? Again, it's a young industry, had to focus on what is the core of it, right? The women is what brings, plays a big role in the fertility piece, uh,
mhm.
and pregnancy and delivery, bringing to life. But guys play 50% of that role to make that embryo work and be able to. And now more and more evidence is showing sperm have an impact even during the pregnancy and further along in the child's life. Uh,
Yeah.
and so I think what we need to do right now is highlight that, and I frankly think that we need to be bold in talking about it and on the awareness level. So guys, because that's been one of the biggest friction points here. What we've seen is that guys just saying, "Oh, it's not me." Like when it's a problem, I'll check in.
Yeah.
But when you combine that with people having kids later,
Mm,
and not having that big window to have, you can't spend now 10 years trying to have a child uh,
yeah.
if you want to be successful, especially if you're starting later.
Yeah.
So I think that's where awareness plays a big role
Mm,
in making sure guys understand that they have to play a role. Uh,
yeah.
and we're seeing that. Like we see some people come to us proactively
Mm,
when they get married, when they've had that discussion and they've decided that they wanted to, or when the female partner is getting off of birth control and they're doing their part and they're like, all right, I'll just do mine just to check. Uh,
yeah.
and then system wise, we need to make big changes there because it's still very much focused on the women. Uh,
Mm,
and it's only, I think, if you look at the stats, a lot of guys don't get tested in that first step. Uh,
mm.
Usually a year later, sometimes
Wow.
that they
Wow.
get tested, and it's like an afterthought. Oh, let's check on the guy.
Yeah.
When you're like, why didn't he get checked first? Why did
Yeah.
you put the women through over testing and over treatment
Yeah.
before getting them tested. So I look at those two pieces, the awareness and the system level needs
Yeah.
to improve for us to really make it happen. And our goal is that I think guys get tested first right away,
Mm,
before even the women getting tested,
yeah.
right? Not the other way around. And
Yeah.
hopefully in the next couple of years, that's the shift that happens.
Yeah. I have so many thoughts. So I guess from the system level, because again, you've worked in clinics, you've worked in the healthcare industry. So do you feel like at this point, you kind of anecdotally mentioned it right there, but does it continue to just be the norm for doctors to just like focus solely on the woman when they're dealing with infertility and or is it starting to change where they're like, let's look at both of you here and kind of analyze? Do we have a lot of work still left to do in that perspective in terms of how our healthcare professionals are approaching it?
Yeah, it's a great question, and I don't want to pin it just on them, but I think when we analyzed and looked at the different clinicians that are involved in this journey, uh, I think at the core of it is the guy gets the clinician brings in the guy late because of how the journey is for
Mm,
fertility, seeking out fertility treatment. It's usually initiated by the women,
mm,
and typically with that OBGYN who then may refer you to a fertility clinic in that journey, the guy isn't going to their doctor.
mm,
So how can an OBGYN help the guy? So there's
mm,
just like when we mapped it out, we're like, okay, it's kind of the system's fault, also the patient's behavior fault. But
mm,
what can we do to help the clinicians in this journey to bring in the guy at the right time, the man? And so what we've done, actually, interesting enough, is at women's clinics, OBGYNs, primary care, we're going to enable it so you could do the testing. So don't
mm,
send them, send only the women to get tested. Send
mm.
the guy now too.
Yeah.
And I look at it, can we bring innovation to improve these changes and the status quo in terms of workflow? Uh,
Hmm.
because when we went to clinicians and we said, hey, we have like, can we do it this way? They were like, yes, this makes total sense. We'd love to do that.
Okay.
Would love to provide better care. So I think that's how we're thinking of it, and how we're approaching it.
Yeah.
And then ideally, then we can, now they have the tools and if both physicians and the patients understand it, I think that can improve the testing rates and make sure testing is done earlier.
Yeah. Makes sense. Makes sense. And then kind of the other piece of it that you mentioned too was men being like, oh, it's not me. And it just makes me think about like I'm a huge fan of Dr. Brene Brown and she talks about vulnerability all the time and just the importance of being vulnerable in situations. And I think as the years have gone by, like in terms of the way our society has approached a lot of different things, like men are starting, I think, to become more vulnerable, but I think that's a big piece of it, just because if you feel like somebody's attacking your manhood or talking about your sperm, not, producing the way it needs to be, I think men feel very attacked. And so what, you know, I guess how do we combat this? Like how do we start to make men feel more comfortable and open to like be a part of this conversation and just bring it to light that, it does take two to tango and we need to both be open and vulnerable about this.
Yeah, I think we should give that book to every guy that comes to, or every couple, like whoever comes to our service, and just be like, read it, because that plays a big role.
Yeah.
I think it's frankly dumb to equate your manhood to sperm and what's going on, because it frankly isn't. It's variety. There's so many different factors that you have no control over.
Hmm.
And so you need to change your perspective on it. And obviously being vulnerable plays a role because, it might be that you're associated to that. And so I think that plays a role. But on top of that, it's this conversation of uh, it's not in your control and it's something that you don't know if it's what's going on. So you should just frankly get tested.
Mm.
not make it a big deal, remove the barriers,
Yeah.
and then really share that the information like this plays a big role and why and if you could end up delaying having becoming a father because of
Mm.
this. And I think
Yeah.
when you share that way, it has a huge impact.
Yeah.
And then lastly, I would say looking at what has changed in the fertility industry in the last 5 years or so,
Mhm.
or before this, fertility wasn't talked about. It was a very hush-hush thing, and now we're finally openly having conversations like this, and having pieces published about this, about fertility. But I think that's changed, um, and enabled the women, and empowered that. Now we could take a lot of lessons from that and apply it over here.
Mhm.
I would, I think what we need to do is, and I'm already seeing some of it, but like it's in the early days, like fatherhood, like
Mm.
men coming together. It may be a different setup than what it would be with women coming together. But what I noticed early on with the how fertility has grown is women coming together to support each other, to
Mhm.
educate each other, to coach each other.
Mm.
I think guys will do that too, maybe in a different way, but guys, that's going to make a huge impact. And so I would love to see more of that, where that people are helping each other and they can then share like this is pretty normal. Like just
Yeah.
do it, right? I think that for guys especially removes a lot of that wall that they have, right?
Yeah.
And
Yeah.
realize, oh, it's not a manhood thing. If
Yeah.
he I could talk forever about it. The My last one is the language we use. And this is
Mm.
something I'm training myself to not do, but shooting blanks. Uh,
Mm.
I don't think that helps. And even in a joking way, I think we need to change that and not talk about it that way. Uh,
Yeah.
and that would help really make sure guys understand and appreciate it and see it from a different perspective.
Yeah. I love that. That's a great point because I think people are just so kind of casual in the way that they talk and they don't really think about the implications and then it makes people feel a certain kind of way and then, down we go down the hill. So, appreciate you calling that out. Well, yeah, I think we could both agree that we could talk about this for several more hours. So any other like final burning thoughts or points that you feel like you have to make before our viewers tune out?
Just number one, get checked. Everyone, if you're getting married, you want to have kids, just go do it. It's the easiest thing. You could do it at home. Like, I think it gives you a lot of clarity and assurance, and also like just what you need to do next. There's a lot that could be done if there's issues. So I want every guy to get checked. I think it's a no-brainer now. And then the I think with the journalists and just in general, I think we need to have more of these conversations
Mhm.
about male fertility and men's health, um,
Yeah.
and how this is an important piece because men usually don't. I think male fertility and what we're seeing right now and the rates and everything is a symptom of just overall men's health and how we take care of ourselves.
Mhm.
So I would love to have more of these conversations so we can really understand what and tackle it head on and hopefully improve um, overall men's life.
Yeah. Amazing. Well, Thiv, it's been such a pleasure. Once again, Thiv is the CEO and co-founder of Hera Fertility. If folks are interested in learning more about you or what y'all do at Hera, what's the best way for them to get in touch?
Yeah, you can go on our website. It's herafertility.co. You can email me if you have any questions. It's Thiv, at herafertility.co. And yeah, we're always happy to help. If you have any questions, just trying to navigate the journey. Fertility is sometimes can be very much a lonely journey,
Mm,
but there's a lot of services and people around to help you. So yeah, feel free to reach out.
amazing. Well, Thiv, thank you so much for your time. We so appreciate you, and we'll be following along your journey.
Thank you. All
Thank
right.
you.